Next up, welcome to Queer News Tonight's Q&A on LGBTQ plus health and pandemic. Since February 2020, this segment has been unique in America, answering you LGBTQ plus community questions about our unique health. We're proud to have Queer News Tonight health anchor, Dr. Howard Grossman.
He's an American pioneer in HIV/AIDS medical treatment and was the executive director of the Academy of HIV Medicine. He's a nationally recognized medical expert and proud member of our LGBTQ plus community.
Well, good evening, Dr. Grossman. And before we move into questions, what are your thoughts over what you've seen in this week's health news for our community?
Well, I think we had some very good news this week, actually, in regard to vaccinations. So we heard two things this week. One, that the Pfizer vaccine seems to be very active in children. So the idea that hopefully by Halloween we can start vaccinating 5 to 11-year-olds, that they had a good antibody response. And the other news today was that the J&J vaccine, when boosted, seems to be about 94% effective, which puts it back in the range of the other vaccines. So I think those are really good. That's really good news, and I think hopefully will help people.
And before we jump into other questions, are you here in Florida, or are you in your new home in Chicago?
I see, Paul.
No, I'm still here packing. If you see behind me all the boxes.
Oh, yeah, I see now. Okay, great. All right, we've got to have dinner before you leave. All right, okay. Gabriel, jump in.
Yes, Dr. Grossman, good evening. It was recently announced that a low-dosage shot of the Pfizer vaccine for children between 5 and 11 is showing positive results. Do you think schools will require, like they do for other vaccines?
That's going to be a government decision, unfortunately, for people here in Florida. Our governor is not going to mandate it. It's going to keep telling people that they should make their own decisions. But I think in other places, you're pushed very strongly. I would imagine the mayor of New York is going to be pushing very strongly to vaccinate those million-plus children going to school there. So I think, once again, it's going to really depend on where you live.
As I rarely have the opportunity to go from children to horses, but we're going to do that tonight.
Do that then you.
Dr. Grossman, horse owners are unable to get ivermectin for their livestock due to people thinking it's a COVID cure. Can you see this happening with other products?
Well, I'm not sure. They're pushing things like colchicine, which is used for gout, and some other things. There is a human use for ivermectin, but that's for scabies, and it's a single dose and it's a human dose, not a horse dose. I think there's a big difference between horses and people, at least as far as weight goes, I hope. Yes. I read stories now that the veterinary places are locking it up the way that the pharmacies lock up antihistamines. It's just crazy. And emergency rooms around the country are reporting, poisonings from ivermectin. There's clear data. Very early in the epidemic, there was some question about whether it might work. And, I know that in Fort Lauderdale at Broward Health used it. It didn't work at all. And there's clear data that says it doesn't work. And in fact, at horse doses, it's going to poison people.
I just, as a follow-up there, Howard, I'm honestly very confused about this. What is going on in someone's mind that they reject a vaccine from Moderna or Pfizer or Johnson, but then they're willing to use the horse liver injection? What's going on in their mindset to come to that conclusion? What do you think it is?
I think it's two things. We live in this anti-science society that people have been trained for years not to trust science and to think, to not believe in it. From climate denial to, you name it. Talking about, Donald Trump and hating wind power. But I think that more of this is, reading a lot of things is just fueled by this rage against any authority. People who are feeling and being told that they're disenfranchised, and lied to in that way. And so they just rage about everything. I think there's the level of anger in this country is just unbelievable, and it's fed by the media, which tries to keep people's eyes glued to the TV screen rather than educating people.
Yeah,
you know,
absolutely.
present company accepted.
Yeah, and it's crazy, I think, because science made ivermectin. So it's still a medical product, but yet they'll take that over something that has actually been proven to work to keep people. But anyway, Dr. Grossman, another question.
I love the way the people who say this, that while they're busy smoking cigarettes,
Right.
or whatever they're doing that's hurting their bodies, they're perfectly willing to do that, but not to take a medicine.
Well, next question for you, Dr. Grossman. There was a vigil this evening in Orlando to honor the 50,000 Floridians who have died to COVID. Do you think events like this help people realize how important it is to get vaccinated?
They hurt, but truthfully, I think those events really are speaking to the converted. The people who show up at those things are going to be people who believe in science, believe in the vaccine, believe that we can stop this together. And the other people just ignore it. The 80 million people in this country have not received a single dose of vaccine as of today.
Mind-boggling.
Wow. Amazing.
It's amazing. I heard, does it, well, I already know the answer, but I heard Africa is sitting at about 4% vaccinated on the continent.
Wow.
These skeptics about vaccine boosters. And one of the things that they keep pushing is a social agenda that we should be sending vaccine to third world countries. But truly, the solution is not we can't generate enough vaccine for the world. But what we could do is break the patents for enforce what they call compulsory licensing, that they need to share their technology with other countries so they can build their own factories to make their own vaccine. That would be a way to treat the world.
Yeah, absolutely. All right. Well, that is this evening's Queer News on LGBTQ plus health and pandemic. We're here every Tuesday with Dr. Howard Grossman to answer your questions. Do you need medical assistance? And of course you do. We encourage you to contact Dr. Howard Grossman, who will be joining, as I alluded to, the team at the Howard Brown Medical Center in Chicago. And this is the largest LGBTQ plus health resource in the entire Midwest. Thank you again, Howard, for being with us tonight. LGBTQ plus for our community and for the broader world as a whole. We have enough enemies at Fox News. Tucker, Sean, and Laura are loud. We need Happening Out television network, Queer News Tonight, and It's Happening Out are literally out of the closet and into the headlines. Our community needs your support. Broadcast and subscribe now to ensure the growth of the entire LGBTQ plus community.